Okay, so hi everyone. My name is Kylie James. I am a certified nutritionist at Curry Nutrition, and I'm here with Jennifer Glazer, who is a naturopath doctor that specializes in autism. So, welcome, Jennifer. Super excited to have you come on because um, kids on the spectrum is such a fascinating area with regards to gut health and biochemistry. And I feel there's so much that a naturopath doctor can do to help with that. But I guess as a parent, as a mum, looking for what they can do for their child, why would they come and see you specifically?
Okay, well, first of all, thanks for having me, Kylie. So happy to be here with you today. Um, why a mom would come to a naturopathic doctor specifically for a child on the spectrum? Well, there's many reasons. We look at the child as a whole, and we really delve into what the root cause of the issue might be. So, for instance, a lot of children on the spectrum have gastrointestinal issues. They suffer from constipation, they suffer from diarrhea, bloating, um, gastroesophageal reflux, and so on. But there's research out there that says that kids that have something as simple as constipation that can affect behaviors. So looking at the gut and the microbiome, all those wonderful bacteria that live in our gut, is super important because there is a huge gut brain connection. So that's a really big focus in my practice. And I don't think that the medical community has completely caught on to this yet.
It's so interesting you say that because I did research out there to look at all these different companies that specialize with autism. And they have behavior therapists, occupational therapists, speech language therapists, but I never was seeing like nutritionists or dietitians or
Right.
naturopath doctors. It just wasn't part of like the program, which I thought that was pretty profound because there is such a huge role. Can you give me an example, like a case study of a client that you saw, and just walk me through like what you did with them and what the results were at the end?
Sure. Well, looking at, say, a child that um, is diagnosed with autism and they suffer from constipation and self injurious behavior, uh, they might have some OCD like symptoms. So I would take a full medical history from the prenatal period to current day. And that will give me a lot of clues as to some of the impetuses or the predisposing factors that might be involved in the development of the disease. And then once we've done that, I will run specific laboratory testing. Uh, and that would include blood tests if we're able to get blood from the individual, whether they're if they have a huge fear of needles, then obviously I don't force a child to take a blood test. That we would look at stool analysis, specifically comprehensive digestive stool analysis, and again, really mapping out the bacteria in the gut, looking at the beneficial bacteria, looking at um, pathogenic bacteria. And a very common finding is an overgrowth of yeast, which can cause all kinds of silly behaviors in children, inappropriate laughter, which is a common complaint from parents, sleep problems, and also OCD like behaviors. And then also, you might find overgrowth of um, bacteria, specifically Clostridia species. And you might find aggressive behaviors and violence in children that have an overgrowth of these types of species in their gut. So we really have to pinpoint what the issues are, and the lab testing becomes a very important tool in trying to figure out.
So once you've done that, what happens then? What's the next step?
Well, then we review the results, and you also have to, taking a step back, we have to also look at diet, as I'm sure you're aware, being a nutritionist. The foundations of the treatment need to be laid down, and usually a foundational treatment is diet, dietary changes, dietary intervention, looking at the environment as well, making sure that there's no toxins in the environment, whether that be chemical toxins, heavy metal toxins, mold biotoxins. Um, and then once with those sort of foundational things have been dealt with, then we review the results that come back from the lab, and we layer the supplementation and the treatment according to the results. So no child is ever treated the same. I don't have a recipe to give you to say, this is how I treat autism.
Yeah.
Um, because everybody has a different medical history. Some kids might come in, they might be vaccine injured. Some kids might have had a mold infestation or water damaged house. Some kids have immune issues. Some children have mitochondrial dysfunction. So it's really so multifactorial
Mhm.
that there really is no one size fits all treatment protocol.
Yeah, I think that's a real important piece, right? Is finding out what that underlying issue or issues are that are contributing to the behaviors and cognitive and social issues that the child might be having. So once they see you and then you recommend supplements, is there anything else that you recommend?
It could be B12 injections are often very common to sort of initiate speech in a lot of children. Um, there could be some sort of heavy metal detoxification that goes on. I do gut sort of, I call it like a heal and seal the gut. We have to deal with any dysbiosis or intestinal permeability, heal that up, deal with immune irregularities, autoimmune diseases. So, treatment can last anywhere from 6 months to 4 years. There's always something that needs to be sort of dealt with.
And I guess also too, sometimes you can't deal with everything at once, right?
That's
So it's like,
exactly right.
so as when you said layer the supplements, I was like, oh
Yes.
yeah, I could imagine that with just treatment in general.
Right. So there's usually a hierarchy or a
Yeah,
priority of things. And always I start with the gut because
that brain connection is fascinating.
that's a huge source
Fascinating.
of inflammation. So
Yeah,
we really have to, sort of quench that inflammation and that inflammatory response. And then once you deal with the inflammation in the gut, that deals with the inflammation that's going on in the brain. Um, so, yeah, there's definitely a priority, and you sort of have to do one at a time. You cannot do everything at once.
yeah. And it's overwhelming for the parents and for the child.
And I
And
think it's dangerous.
yeah, yeah. So I'm going to backtrack here. Why did you decide to get into specifically kids with autism as a naturopath doctor? Why did you choose that route?
That's a good question, actually. It started, I guess, after graduation. I graduated about 21 years ago now. And it was actually a family member that came to me. Um, Her son was just diagnosed. He was 2 at the time. And I didn't know anything about autism. We didn't really learn about it in school, but she was beside herself, and I wanted to help. And I just started taking all kinds of, you know, educational seminars and I flew all over going to MAPS conferences. And at the time it was called Dan conferences. Now it's changed to MAPS, which is Medical Association of Pediatric Special Needs. So I was taking all of these courses to try and help him recover. And that's pretty much sort of how I got into it.
Yeah, awesome. That's so cool. So thank you. I really appreciate coming on, and we share a couple of mutual clients. It's been
Yes,
awesome working with you. You do a great job. So what we'll do is we'll put in the links to how people can contact you if they want to have a consult with you.
fabulous.
Um, yeah. So what is the best way to contact you if people want to?
I would say by email.
Yeah, and that
So
is
Dr. Jennifer Glazer
yeah.
at gmail.com.
Awesome. Great. Well,
Thank you
thanks so
so
much
much.
for joining me and sharing a little bit of insight about what you do. I just think it is amazing and just so important. And I wish more parents could work with people like yourself to really help get to those identify what those underlying issues are and really start working on them. Yeah, that's awesome. Okay, great. Thanks
Thank
so
you.
much.
Bye-bye.